the first thing I do as a clinician, if someone comes to me and says they're depressed, is ask myself a question. Well, what does this person mean by that? So I have to find out, because maybe they're not depressed, maybe they're hyper anxious, or maybe they're obsessional. There's various forms of powerful negative emotion. So they need to be differentiated. But then the next question you have to ask is, well, are you depressed, or do you have a terrible life? Or is it some combination of the two? So if you're depressed, as far as I can tell, you don't have a terrible life. You have friends, you have family, you have an intimate relationship, you have a job or a career. You're about as educated as you should be given your intelligence. Use your time outside of work wisely. You're not beholden to alcohol or other temptations. You're engaged in the community in some fundamental sense, and all that's working. Now, if you have all that and you're feeling really awful, you're either ill or you're depressed. And so then sometimes there's a biochemical route to that, treatment of that. My experience has been as a clinician is if you're depressed, but you have a life and you take an antidepressant, it will probably help you a lot. Now, maybe you're not depressed. Exactly. You just have a terrible life. What does that look like? You have no relationship. Your family's a mess. You've got no friends. You've got no plan. You've got no job. You use your time outside of work, not only badly, but destructively. You have a drug or alcohol habit or some other vice, pornography addiction. You are completely unengaged in the surrounding community. You have no scaffolding whatsoever to support you in your current mode of being or you move forward. And then as a therapist, well, you do two things. Well, if it's depression per se, well, like I said, there's sometimes a biochemical route, a nutritional route. There's ways that can be addressed. It's probably physiological if you're, at least in part, if you're depressed but you have an okay life. Sometimes it's conceptual. You can turn to dreams sometimes to help people because dreams contain the seeds of the potential future. And if your person is a real good dreamer and you can analyze dreams, that can be really helpful. But that seems to be only true for more creative people. And for the people who just have a terrible life, it's like, okay, you have a terrible life. Well, let's pick a front. How about you need a friend, like one sort of friend? Do you know how to shake hands and introduce yourself? I'll have the person show me. So let's do it for a sec. So it's like this. Hi, I'm Jordan. Right? And people don't know how to do that. And then they can't even get the ball rolling.
For the listener, Jordan just gave me a firm handshake.
Yeah, as opposed to a dead fish. And there's these elementary social skills that hypothetically, if you were well cared for, you learned when you were like 3. Yeah. And sometimes I had lots of clients to whom no one ever paid any attention. And they needed like 10,000 hours of attention. And some of that was just listening because they had 10,000 hours of conversations they never had with anyone. And they were all tangled up in their head. And they had to just, one client in particular, I worked with this person for 15 years. And what she wanted from me was for me just to shut the hell up for 50 minutes, which is very hard for me, and to just tell me what had happened to her. And then what happened at the end of the conversation, then I could discuss a bit with her. And then as we progressed through the years, the amount of time that we spent in discussion increased in proportion in the sessions until by the time we stopped seeing each other, when my clinical practice collapsed, we were talking about 80% of the time. But she'd never been attended to properly, ever. And so she was an uncarved block in the Taoist sense, right? She hadn't been subjected to those flaming swords that separated the wheat from the chaff. And so you can do that in therapy. If you're listening and you're depressed, I would say if you can't find a therapist, and that's getting harder and harder because it's actually become illegal to be a therapist now because you have to agree with your clients, which is a terrible thing to do with them. Just like it's terrible just to arbitrarily oppose them. You could do the self-authoring program online because it helps you write an autobiography. And so if you have memories that are more than 18 months old that bother you when you think them up, part of you is locked inside that. An undeveloped part of you is still trapped in that. That's a metaphorical way of thinking about it. That's why it still has emotional significance. So you can write about your past experiences, but I would say wait for at least 18 months if something bad has happened to you, because otherwise you just hurt yourself again by encountering it. You can bring yourself up to date with an autobiography. There's an analysis of faults and virtues. That's the present authoring. And then there's a guided writing exercise that helps you make a future plan. That's young men who do that, could go to college. Young men who do that, 90 minutes, just the future authoring, 90 minutes. They're 50% less likely to drop out. That's all it takes.